31. Choose an appropriate indication to stop or withhold resuscitative efforts. A. Arrest not witnessed. B. Evidence of rigor mortis. C. Patient age greater than 85 years. D. No return of spontaneous circulation after 10 minutes of CPR. Correct answer, option B. 32. A 49-year-old woman arrives in the emergency department with persistent epigastric pain. She had been taking oral antacids for the past 6 hours because she thought she had heartburn. The initial blood pressure is 118/72 millimeters heart. The heart rate is 92 per minute and regular. The non-labored respiratory rate is 14 breaths per minute, and the pulse oximetry reading is 96%. Which is the most appropriate intervention to perform next? A. Administer oxygen. B. Obtain a 12-lead ECG. C. Evaluate for fibrinolytic eligibility. D. Administer sublingual nitroglycerin. Correct answer, option B. 33. A patient in respiratory failure becomes apneic but continues to have a strong pulse. The heart rate is dropping rapidly and now shows a sinus bradycardia at a rate of 30-minute. What intervention has the highest priority? A. Atropine IV push. B. Epinephrine IV infusion. C. Application of a transcutaneous pacemaker. D. Simple airway maneuvers and assisted ventilation. Correct answer, option D. 34. What is the appropriate procedure for endotracheal tube suctioning after the appropriate catheter is selected? A. Suction during insertion, but for no longer than 30 seconds. B. Suction the mouth and nose for no longer than 30 seconds. C. Suction during withdrawal, but for no longer than 10 seconds. D. Hyperventilate before catheter insertion, and then suction during withdrawal. Correct answer, option C. 35. While treating a patient with dizziness, a blood pressure of 68/30 millimeters Hg, and cool, clammy skin, you see this lead to ECG rhythm. What is the most appropriate first intervention? A. Aspirin. B. Atropine. C. Lidocaine. D. Nitroglycerin. Correct answer, option B. 36. A 68-year-old woman experienced a sudden onset of right arm weakness. EMS personnel measure a blood pressure of 140 divided by 90 millimeters Hg, a heart rate of 78 minutes, a non-labored respiratory rate of 14 breaths minutes, and a pulse oximetry reading of 97%. The lead 2 ECG displays sinus rhythm. What is the most appropriate action for the EMS team to perform next? A. 12-lead ECG assessment. B. Administration of 100% supplementary oxygen. C. Cincinnati Pre-Hospital Stroke Scale Assessment. D. Administration of a low-dose aspirin. Correct answer, option C. 37. EMS is transporting a patient with a positive pre-hospital stroke assessment. Upon arrival in the emergency department, the initial blood pressure is 138/78 millimeters Hg. The pulse rate is 80 minutes. The respiratory rate is 12 breaths minutes. And the pulse oximetry reading is 95% on room air. The lead 2 ECG displays sinus rhythm. The blood glucose level is within normal limits. What intervention should you perform next? A. Head CT scan. B. Transfer to the stroke unit. C. Immediate RTPA administration. D. administration of 100% oxygen. Correct answer option A. 38. What is the proper ventilation rate for a patient in cardiac arrest who has an advanced airway in place? A. 4 to 6 breaths per minute. B. 8 to 10 breaths per minute. C. 12 to 14 breaths per minute. D. 16 to 18 breaths per minute. Correct answer, option B. 39. A 62-year-old man in the emergency department says that his heart is beating fast. He says he has no chest pain or shortness of breath. The blood pressure is 142 by 98 millimeters Hg. The pulse is 200 per minute. The respiratory rate is 14 breaths per minute, and pulse oximetry is 95% on room air. What intervention should you perform next? A. Obtain a 12-lead ECG. B. Give 150 milligrams of amiodarone. C. Administer 160 milligrams of aspirin. D. Administer 6 milligrams of adenosine. Correct answer option A. 40. You are evaluating a 48-year-old man with crushing substernal chest pain. The patient is pale, diaphoretic, cool to the touch, and slow to respond to your questions. The blood pressure is 58/32 millimeters Hg. The heart rate is 190 minutes per minute. The respiratory rate is 18 breaths per minute, and the pulse oximeter is unable to obtain a reading because there is no radial pulse. The lead 2 ECG displays a regular wide complex tachycardia. What intervention should you perform next? A. Procedural sedation. B. 12-lead ECG. C. Amiodarone administration. D. Synchronized cardioversion. Correct answer, option D.